Ascariasis is a condition caused by the infestation of the body by the roundworm parasite genus Ascaris. A study conducted in the Champasak province estimates that the majority of individuals harbor at least two harmful parasites, 31% of which are directly related to Ascaris lumbricoides. Vomiting, diarrhea, and gastrointestinal obstruction are a handful of possible side effects resulting from Ascariasis. In addition, the proximity between people and livestock makes zoonoses a critical concern. Poverty and poor education are the primary driving forces behind the proliferation of Ascariasis. It is estimated that a third of Laos citizens live in poverty. Many households lack proper toilet facilities, forcing individuals to urinate and defecate on surrounding land. Hand and food washing is an unrealistic expectation due to a lack of clean water sources. The average length of education for Laos citizens is 3.5 years, and approximately 30% of household heads are illiterate. Additionally, many Lao people do not comprehend a link between hand washing and the spread of helminthiasis.
There are a number of potential top-down initiatives to address this disease. Since it has a fecal-oral transmission route, Ascaris eggs from infected sewage may get into soil where people plant food crops or where animals graze or could contaminate drinking water. This results in a reinfection cycle. A solution is to implement waste treatment infrastructure. Currently, many households in rural Laos do not have toilets, and there are no water treatment facilities in these areas. We could work with the government to build restrooms and establish on-site sewage treatment. Cost would be considered, and we would consult professionals for the design and construction. Due to the durability of the eggs in the environment, we should also discuss the distribution of filtration devices with the appropriate government agencies. Another initiative is to implement programs in which children are periodically given antiparasitic drugs. A similar program could be implemented for animals. These programs could be subsidized. We would work to ensure reliable supply and transport of these drugs to rural communities.
There are also many bottom-up initiatives we can take to address roundworm infections. Most of these approaches emphasize preventive health measures in the environments of two major stakeholders. First are school children. A team of doctors, educators, and community leaders can work together to teach the students the importance of practicing proper hygiene. This can include how to properly wash hands, wear proper footwear, and avoidance of human and animal feces. Moreover, education about roundworm symptoms and effects can motivate the students to bring the message back to their own households. In agricultural areas, both humans and animals are at risk of roundworm infection due to the common use of fresh feces as fertilizer. Therefore, we can educate farmers on how to properly compost solid waste to get rid of any parasites before using it to grow food. This will decrease chances of the worm being transmitted via contaminated vegetables.
When it comes to implementing initiatives, there will be roadblocks. For instance, enacting policy. Laos is a one-party communist state with a system of unilateral decision-making and has a bad track record for turning a blind eye to environmental and public health issues, as evidenced by large-scale illegal logging and deforestation, the illegal Jayaberry Dam along the Mekong River, and for making opposition leaders disappear. Top-down initiatives will require coercive diplomacy. Key important platforms for potential sanctions include trade relations with the U.S., Laos membership within the World Trade Organization, and plans for railway systems allowing Laos to become a land-linked country. The primary roadblock for bottom-up initiatives will be poverty. Future revenue generated by plans for the sale of hydroelectricity, as well as reallocating current revenues from existing industry, can subsidize public education and public health projects geared toward prevention of Ascariasis.
People in Laos will develop a proactive communication plan that encourages public to raise awareness and educate others about outbreak behaviors and increase disease controls. Setting up a campaign, you become proactive instead of reactive to the outbreak. For instance, contribute your ability to spread the message across the community will decrease the likelihood of someone getting infection. A mass media provides first-hand knowledge, reference, and current status of the disease. People find it useful to gain knowledge on drug prevention and handling situation.
Targeting the community directly regarding the prevention of Ascariasis will require a group effort. The entire community can work together to prevent open defecation, which will prevent the spread. Crops taken directly from the soil need to be properly sanitized because the eggs still remain on the produce. The true mint is available and needs to be stored locally for the community to have their hands on.